Welcome everyone to our webinar series number 3. Today we are going to discuss artificial intelligence and COVID-19. My name is Aya Fujiwara. I'm the director of Prince Takamado Japan Center for Teaching and Research at University of Alberta. I'm very pleased to host tonight's event sponsored by the Consul General of Japan in Calgary. Since its establishment, Prince Takamado Japan Center at University of Alberta has been committed to the promotion of international exchanges between Japan and Canada. The current situation has made it difficult for us to interact in person and encourage student mobility between two countries, which are significant parts of our academic mandate. But we are hoping to continue such engagements in a dialogue through webinars, sharing our ideas internationally in this very critical time. I appreciate the Consul General of Japan in Calgary for its invaluable support, and I'm very honored to have Consul General Shigenobu Kobayashi to be with us this afternoon. Now, I'd like to invite Consul General to make his opening remarks. Soryoji, お願いします。
Good morning, good afternoon, and good evening. Welcome to this webinar seminars organized by the Prince Takamado Japan Center for Teaching and Research. This is focusing on the aging society in the era of pandemic. And today's topic is about artificial intelligence, AI. First, I would like to say thank you for the Prince Takamado Japan Center for organizing this kind of the very timely, topics. And also I would like to say thank you for the participant speakers. From Canada, Dr. Randy Goebel. He's an Associate Vice President of the Research and Innovation and the fellow and co-founder of Alberta Machine Intelligence Institute. And of course, he's a professor of computer science at the University of Alberta. From Japan, Mr. Yuzuru Tanaka, Professor Emeritus Computer Science at the Hokkaido University. He's also the adjunct professor in computing science at the University of Alberta and also the PO of the JST Quest program on big data applications. 田中先生、よろしくお願いいたします。For me, a relatively aged person, this kind of the artificial intelligence is a little bit, something like a fantasy or out of reach everyday life. It's a kind of the stuff of imagination. There are so many stories in the science fiction novels and the comics. But recently, the science developed so dramatically, in a speedy way. So the AI has facilitated several advances in science and also allow us a greater freedom in our daily life. Even in a society, for instance, Japanese Prime Minister, Mr. Suga, he announced establishment of the Digital Governmental Agency. So this is not in the future story, real one. And we are going to utilize this kind of the tool very effectively, not only in the medical, but also the other areas like space exploration, data analysis, or the many other important areas as well. So I'm quite curious to learn about from the discussion today, Dr. Goebel and Dr. Tanaka's discussion about this issue. And I think this is a very important step for us to consider how to tackle or how to manage or how to fight against the COVID-19. We are also expecting much, much better future because of this very important and valuable tools. Once again, thank you very much for the organizer, Prince Takamado Japan Center for Teaching and Research, led by Dr. Fujiwara, and also the speakers, Dr. Goebel and Dr. Tanaka. Thank you very much for your way of participation and speaking. Thank you very much. I would like to listen to your discussion.
Consul General, thank you. Now I'd like to introduce today's moderator, Chelsea Meir. She's a PhD candidate in the Department of English and Film Studies at University of Alberta. Thank you, Chelsea.
Thank you so much, Aya, and welcome to all of our viewers watching from home. First, we'll be hearing from Dr. Yuzuru Tanaka. Dr. Tanaka is a professor emeritus of computer science at Hokkaido University and an adjunct professor in the Department of Computing Science at the University of Alberta. He is also the program officer of the JST CREST program on big data applications. Welcome, Dr. Tanaka.
I was asked to give you a short survey of AI technologies in coping with COVID-19. So I will talk about them, categorizing them into 4 phases of disaster management. These 4 phases are preparedness, prevention mitigation, response, and recovery. Let me start with preparedness. In 2015 TED Talk titled The Next Outbreak, We Are Not Ready, Bill Gates talked about computer models to predict that pathogen as virulent as the 1918 Spanish flu would kill 33 million people worldwide in just 9 months. In this talk, he emphasized the necessity of regular war simulations to test the preparedness. So this kind of simulation should be more like war games, but not just like a pandemic simulation. As to the prevention mitigation phase, the first thing is the detection. Data miner gave the earliest alert on COVID-19 on December 30th, in advance of the US government's announcement 7 days later. Around the same time, Toronto-based Blue Dot gave another alert. It used AI and machine learning to track and predict the outbreak and spread of unusual pneumonia cases happening around market in Wuhan. It gathers data on over 150 diseases and syndromes, searching every 15 minutes, 24 hours a day. As to response, the most important thing is the real-time monitoring and visualization. Such kind of system is called a dashboard system. An example is an interactive map from Johns Hopkins University. And forecasting is also very important. On April 10th, Japan's government requested people in the 7 prefectures under a state of emergency to reduce person-to-person contact by at least 70%, preferably 80%, based on the epidemic simulation by Professor Nishiura at Hokkaido University. Later, he moved to Kyoto University. The declaration changed the scene in Tokyo. The white bottom is the famous iconic pedestrian crossing at Shibuya at that time, just after the declaration. AI-assisted testing is also very important. An example is on the deep transfer learning-based automated detection of COVID-19 from lung CT scan slices. Another example of AI-assisted testing uses a cough sound. A team at MIT using the large cough database identifies asymptomatic people with a remarkable 100% detection rate. Contact tracing is also important technology. Apple and Google jointly developed COVID-19 contact tracing technology released for the public use. Cocoa is the Japanese version, and it uses their technology, Apple and Google technology. It is officially provided by the ministry since May 26. Genome analysis of the virus is also very important in the response phase. This shows the phylogenetic tree visualization of geographic distribution of virus mutations. In the recovering phase, discovering new treatments and supporting new normal life are 2 important themes. The former includes computational drug repurposing, discovery of new viral inhibitors and of new potential drugs to prevent virus binding with human cells or replication of viral RNAs. For that purpose, literature-based knowledge discovery technology mainly used. For supporting new normal life, we use remote work and remote education tools, contact tracing tools, service platforms for new normal. And one of the very important technology is the countermeasure against cyber attack and disinformation in this era. This is the example of discovering new treatment, computational drug repurposing. This shows the result done by Professor Okuno at Kyoto University. He used Fugaku, the new supercomputer in Japan, to discover drugs that bind to target protein unique to SARS-CoV-2. He tested over 2,000 existing drugs, and the target protein was the main protease of the virus. It took 10 days to find 30 existing medication as candidates. This shows another example of literature-based knowledge discovery. Based on the extracted knowledge, they visualized all concepts associated with the virus, also shows all the treatments for COVID-19 with the relationship among them. This is an example of a support for new normal life. This shows the public demonstration experiment of Japan Post autonomous delivery robot. This is a funny example of the application of telepresence robot. Students attend a graduation ceremony at BBT University in Japan via telepresence robots. This robot's developed by ANA, one of the Japanese airline company. Congestion information service is also a good support for new normal life. And this is the system developed by Unori. It covers 28,000 stores and shows the current congestion and congestion record of the last week of a specified store. This concludes my short survey of the current technologies.
Thank you so much, Dr. Tanaka. You've given us so much to think about. Next, we'll be hearing from Dr. Randy Goebel. Dr. Goebel is a computing science professor at the University of Alberta. He is also Associate VP, Vice President of Research and Innovation, and a research fellow and co-founder of Alberta Machine Intelligence Institute. Welcome, Dr. Goebel.
I first want to thank my colleague, Yuzuru Tanaka. He and I have worked together for longer than I can remember, maybe a couple of decades, working together on AI, big data analysis, and visualization. So we share similar dispositions on how to communicate what AI can do in a variety of application areas. I'm glad that he went first because he provided some level of granularity detail that I will try to summarize in a slightly different way. And that is just to talk about how artificial intelligence can in general be useful for at least two aspects of public health, which I'll try to make clear here. And the broad application of AI is really about getting machines to build models that can make actionable predictions. That is, can make a prediction that provides a decision maker with a way to make a public health intervention. For example, imposing quarantines on places where you have a model of how quickly an epidemic is spreading, or in addition, to have models to predict where to find systems biology solutions that help inform us about biology and about, for example, vaccines, as Professor Tanaka spoke about. Here are two examples. Is that at my own university, you may have heard about the recent Nobel Prize to a virologist, Michael Houghton, in our Institute for Applied Virology. They've done something from which this example comes. Pattern analysis of 13 billion small molecules can identify 10, for example, within about 2 weeks that could be synthesized for further study as potential vaccine candidates. So that's an example where artificial intelligence is informing decisions about which protein molecules might be most useful in further pursuit of potential use as vaccines, for example. But there are also AI applications in what you might call public health or public precision health. For example, COVID testing suggests tomorrow's testing attention should be at schools A and B in Southwest Calgary. That is to use actual data to make what I call short cycle predictions about where to pay attention to rapid hotspot spreading of particular diseases, in this case, driven by the opportunities created by COVID. So there are at least those two broad areas of application, and one should not believe that there is application only in the latter, public health, or in the former, systems biology. So that's part of the point there. Give you recent examples. This one with AI tools for health. In systems biology, that is the understanding of biological mechanisms under or forming the foundation of human and all biology, is a recent paper from my friends at DeepMind. DeepMind has offices starting in London and England, and the second one in Alberta here in Edmonton, so we have close connections. Is AlphaFold is using the architecture on the right, broadly speaking, to take amino acid sequences and to use data about labeling those sequences with respect to how they fold into building, dynamically building these two components, which are about how proteins can be refolded to show how they interact with other molecules in the environment. So while we always see static pictures and images in these tertiary models of proteins, none of these objects stand still. They're all dynamic, they're all moving, and some of them are prone to fold and unfold and create consequences that are either positive or negative. For example, University of Alberta has one of the best protein pre-unfolding groups, which tries to model and measure how proteins fold to cause diseases like bovine spongiform encephalitis. So that's the systems biology side. AI can be applied there to build models to create actionable inferences, that is, which of those protein models to use in their folding exercises. But there's another one, and Professor Tanaka spoke about the use of AI and big data management to do contact tracing, to be able to see where the epidemic spreads are most prevalent, where the hotspots are, and so on. And one must be very cautious when you do that. So, for example, I note that our current provincial government has stepped up and announced to the public that they will increase the number of human contact tracers from which started out about 200 when I started working with them, up to 800 by the end of this calendar month, that is the end of the calendar year, and in the new year up to 1,600 people doing contact tracing. In this image, you see a bunch of people sitting at desk carols, and what they do is they get Alberta Health Services data on confirmed COVID cases tested within the system. They are trusted to contact people who have been confirmed as having COVID and ask them questions about who they have had contact with and where they've been in the last 14 days. As Tanaka Sensei showed in one of his slides, is we can hope to address part of this problem with smartphone apps, which when given accurate information can try to do that short cycle model building to inform where to look next and where the at-risk populations and geographical locations are. However, the challenge is that is in this slide on the right is a kind of a secret inside of Alberta Health Services transcript. So what the contact tracers do is phone people and generate typed files regarding the progress they've made and understanding where those 1,800 people per day have been in the last 14 days. This has created an almost impossible problem. In my opinion, what we need is not more contact tracers. What we need is more focus on turning this kind of information into a dashboard, as Tanaka Sensei said, a dashboard of where the most recent outbreaks are and to inform decisions about how to take public health actions like new quarantine measures to prevent those outcomes. So far, generating nearly 12,000 of these typed transcripts from talking to people on the phone per day has generated so much data that Alberta Health Services is overwhelmed by trying to interpret it. So that's another place where we need natural language processing to build the dashboards from those sequences and those tools. One of the things that many of the people in the health system distinguish is between so-called personal medicine, is the momentum of the Human Genome Project, which suggests that we can sequence your genome and with enough attention find the one that is uniquely yours to be able to do personalized medicine, which is the top. Reduce the size of the cohort, this one's a subset of this one and so on, until we identify an individual by their individual genome. The idea makes abstract sense, but in health economics terms, it's impossible because no drug company is going to produce an intervention uniquely for you and your genome. The alternative is to do what Lee Hood, the creator of the Institute for Systems Biology in Seattle, is to do precision or stratified medicine, where you simply look at the data that distinguishes one population from another. We can distinguish males from females, and we rarely give drugs related to pregnancy to males, for example, but we use data and biomarkers to distinguish a cohort that you're in and say, here's the best treatment we can give you from a precision or stratified medicine point of view. Those two different ways of thinking about AI are uniform for the AI scientist and are sometimes distinguished as completely distinct for physicians. But in fact, you can do what I call precision public or population health. That is, you can actually distinguish biomarkers, like, for example, if you have diabetes type 2, you're identified in a cohort where there's a public health missive on how to manage that disease, and everybody in that category is treated the same. So be careful to distinguish those two things, is that we can use artificial intelligence to take data, to build models, to distinguish cohorts, either one of which gets a treatment or a whole cohort of which gets a treatment. So precision health is, as I've listed here, for an individual. For example, we know that a gut biome is really interesting because gut biomes have been classified by a number of researchers. They can be the same across culture and geography. They needn't be the case that a person from the Netherlands has a different gut biome from someone in Shanghai, for example, or Tokyo or Sydney in Australia, and so on and so forth. To precision population health, which says we will distinguish properties that talk about a potential intervention for the whole cohort. So that is, when you do randomized clinical trials, you will find that there's a subset of people who receive a certain drug, and the drug has the same positive impact regardless of a whole bunch of other biological properties like gender, like age, and so on. The application of data with AI applies to all of these things. We only have to identify the problem for which we're trying to make a prediction. The last thing I want to say in this regard is that in Alberta, what we've done is the following based on this diagram, is if we think of the exercise and data-informed inference as gathering data, turning it into knowledge with AI, and then taking action by observing the models within clinical practice guidelines, health economics, or outcomes assessment, but most importantly, turning it into a loop. That is, when you're in a cohort and receive a kind of treatment that's supposed to be currently popular for treating the disease or whatever affliction you have, we gather the outcomes, continue to change our models on the outcomes in this circle, and then the next time you go to your physician, you're potentially liable to receive improved treatment because we've learned more by the outcomes of the treatments existing for those diseases. In Alberta, we have two diagrams based on two documents created by the Academic Health Network to inform the important changes we think and are recommended for Alberta Health Services, almost wholly focused on closing that loop. This is one diagram where you see you have a learning system that is in this cycle where the outcomes are used to produce better informed treatments and so on in a circle. That one was from 2017. This one is from the implementation plan of 2018. And that is, you see a health learning system is this cycle of gathering data, building models, making predictions for intervention, taking most importantly, the outcomes, capturing those in a way that allows you to go through the cycle and improve the health intervention next time. So health learning systems are all about using the system itself to gather data to improve it. That's a whirlwind tour of the application of AI in health systems, both on the biology side and the public health delivery side. Yuzuru had said something about literature-based discovery, and let me say a little bit about that. Literature-based discovery takes its foundation as the start of the place, as the starting point, if you like. And you can do this with this kind of data from the current pandemic, which I think accelerates our opportunity to be more careful about this. If people are researching and studying the pandemic based on COVID as intensely as they are, you can't possibly read all the results that are produced. So in this particular instance from the Science magazine said that 23,000 papers are published so far, and that number is doubling every 20 days, amongst the biggest explosions of scientific literature. The good news is that a lot of scientists are refocusing their scientific skills on the pandemic. The bad news is they're generating data so quickly that we actually can't absorb it. My speculation is that in the future, those societies and infrastructure that can actually identify high value science in this explosion of all of these publications will have an advantage. One of the examples I like is from Yu Tu, 2015 Nobel Prize winner. She studied texts written in Chinese 3,200 years ago. I got to look at a 2,800-year-old copy. I wasn't allowed to touch it, only look at it. She discovered the artemisinin and then started to try to synthesize it in a number of ways, use it to treat malaria. Turns out, looking at that literature 3,200 years old was the basis of this discovery that didn't just get her a Nobel Prize, but actually turns out to be one of the most effective treatments of malaria ever. This is not laboratory science directly, it is literature-based discovery. That's the key phrase in that 3,200-year-old document that she looked at. And that's a kind of a time frame when she was looking at it here to now. So you can see that literature-based discovery can be applied using artificial intelligence techniques to actually find and analyze language and look for keys for a long, long time. Another more recent one, just before the turn of this century, was a guy named Don Swanson who suffered severe migraines, and in California went to a whole variety of physicians and clinics to try to find some relief from his migraines. Baffled by the lack of coherence and the contradictory evidence he found for what would do something, he studied a literature. In 1998, he published a summary paper of so-called 11 neglected connections between migraines, and in this case, magnesium. Since then, magnesium has become a core feature of the treatment of not just his migraines, but many others. This is another case where the initial use of natural language processing and if you like, Google-like search was able to help identify connections that an ordinary human could not have found because the size of the literature defied its reading in the conventional way. Finally, I want to pay some homage to Japanese Science and Technology CREST Big Data Applications Project, on which I'm an advisor and which you heard Professor Tanaka is the program officer for. These are just snippets from the scientific document analysis. There is significant progress being made on building tools to automatically extract information from papers. In some way or fashion, it's pretty clear that humans write too many papers and we read too few papers. There are too many written for us to digest the full scope of scientific progress. So this one, most people will be familiar with portable document format, which encodes things in a way that can be transferred between humans for printing and reading, but not necessarily between computers to extract valuable information. So the SciDoc, or Scientific Document Analysis project under JST CREST Big Data Applications, does just that. It's building tools to read the structure from PDF files, to extract information from tables, produce them in a database, and to enable the creation of tools like this one, to able to read documents and find out potentially causal relationships between components in this literature to help guide us, just like the AI filters and building small molecule filters enable us to focus on the germane parts. Thanks for your patience and my also rapid foray into the applications of AI in public health and systems biology.
Thank you so much, Dr. Goebel, and thank you to our speakers and everyone for joining us today for our third webinar. We are now just about a year since the outbreak of the pandemic, and so much has happened since then. And what you've both done is given us this wonderful overview of the many ways that AI has been applied. In previous webinars, we've been looking at the topic of aging society in the era of pandemics. And I wanted to ask you, given the spread of COVID-19 and how much of an impact it's had on nursing facilities, what role is AI expected to play in responding to seniors' needs in Japan and Canada?
One of the applications is the chair robot. The research on chair robot in Japan is very active. It's already exploited in some chair houses. As to the COVID-19, most of the AI technologies developed for COVID-19 is not so specific to senior citizens. How about the situation in Canada?
One of the things that's true about aging, and I work with a couple of people who are interested in what you would call comorbidities, that is, afflictions that arise in senior people. There emerge the interaction between chronic diseases. What's very interesting right now, both with COVID and the pandemic and in seniors, is that the belief is that we have to gather much more specific data to use AI models to disentangle potential causation about, so for example, if you have diabetes, chronic obstructive pulmonary disease, some other kind of gastro or inflammatory bowel disease, there is evidence to suggest that if you have the bad fortune to contract the virus, it can amplify any one of those diseases in unpredictable ways, which doesn't mean that they're causally related. And so that's one of the things that's going on now in some of the discussions in the health systems with research physicians, is try to gather enough data to separate causality. We know that in the multimorbidity cases where people are taking blood pressure medicine for a liver disease or for inflammatory bowel disease, that they may have interactions. For older people, and in the case of the pandemic, the data required needs to build much more refined models to make more predictions about the causal relationships amongst those afflictions. For those of you who know, Tanaka Sensei certainly knows, it's a bit like Stuart Kaufman's genetic regulatory networks, that is, looking for multiple data in the case of multiple diseases and trying to find causation relationships that are strong or weak. And so that's one of the things that's happening that's certainly relevant as you get older, but it's relevant, as Tanaka Sensei says, across the spectrum of health management.
Thank you. That makes a lot of sense. So seniors are one cohort of many who might benefit from these specialized treatment plans that you've been talking about.
And in the treatment plans, it's identifying the causal relationships or not. Maybe there is no causal relationship, right? But it's exposing the causal relationships with the data to be able to investigate further.
Right. Here is a question from Alenka Bilash. Thank you to both speakers. Could Dr. Goebel discuss more specifically the role that AI has played in practice in addressing the COVID-19 pandemic in Canada? And actually, I can put that question to both of you and ask, how do you think that the way that Japan and Canada have utilized AI technology compares?
So one of the things I'm going to be seen as an outlier, because I think that I call jurisdictional Darwinism. And I call it that because there are so many jurisdictions in Canada that make public health intervention decisions based on the politics of the jurisdiction and the little data that they gather. I have great respect, having lived and worked in Japan so much, for the Japanese culture, who is much better able to embrace the discipline required to use data to manage public health. In Canada, we have a variety, for example, of contact tracing apps. Still to date, none of them use actual health data. That is, none of them are empowered with anything except a individual decision to claim they have COVID and then to see what the consequences are. The consequences can be tracked in this short cycle prediction if the people use the app. But consider the first discussions amongst groups of teenagers in Alberta when the Alberta app was introduced. Gee, did you know that app was introduced? It can run on our phones. Why don't we all say we have COVID and see what happens? It's what I call public health graffiti, and that doesn't happen in other jurisdictions. So in Canada, we have lots of amazing expertise, and we're very fragmented, almost chaotic about how we use it.
As to the usage of personal data for contact tracing, it's a kind of trade-off between the privacy protection and the public benefit. For the moment, most of the countries in Japan and the Canada and US, we don't use any mobile data for contact tracing because this is very much personal data. And the situation is quite different from the China's situation. Their contact tracing system sometimes use mobile data directly. They can pinpoint the place and people who are infected, but the situation is quite different. The problem is how to make a good balance between privacy and public benefit. This discussion will continue.
Absolutely, yes. That trade-off is a serious challenge because we don't have uniformity in assessing what is for public good and where to give up personal data and security for public good.
Yeah, that's really interesting. I actually didn't know that Japan has also had limited use, I guess, of apps in contact tracing. To kind of build off of that, you touched on this, I think, in your presentation. Can you talk a bit more about the limitations of manual contact tracing and how AI can help? And again, as you've mentioned now, at the same time, what are the ethical concerns with using AI and contact tracing? And how can we develop more ethical and secure AI-based tracing apps?
So in case of COCOA, they use Bluetooth-based beaming technology. They don't use the location data based on the mobility data, just a nearby contact record. They don't care where it happened. Once some cluster happens, or once some people is recognized as a PCR positive, then the healthcare center will send a special code to this person. It is his responsibility to input he is positive to the COCOA system. It's not automatically done by the authority. Again, the consideration of privacy protection. And because of this, the use of this kind of system is not perfect for the moment.
The reality in Canada with respect to that is that we have health jurisdictions that differ from province to province. So Alberta has a single provider, Ontario has something like 6, B.C. 3, so on and so forth. In principle, one would like them to be coordinated, but it's difficult to coordinate them. So that's one observation just about coordinating the health systems who have captured and have license to use the data the way they want. In our case, we propose systems that take, in our jurisdiction, TELUS, the telecommunications company, has about 40% coverage of the mobile phone population in Alberta. And that data is of great use. The geolocation data of that attributed to individuals is of great use. TELUS, the corporation, is even more cautious about releasing that data than the health system is about the COVID data. So there are two challenges to meet with respect to privacy and security. A third and a fourth aspect that we know we can link. So for example, social media data, Facebook and Twitter, for example, are all public and are all free from any kind of privacy concerns. So we know we can link that data with the TELUS data, with the health data, and improve the accuracy of contact tracing by, my estimates would be, improve its accuracy by 20 to 30% on top of where it is already. But the chance of us integrating that data, even in a demonstration project, is very low. And we hope to be able to use the pandemic as the forcing function to say, if we try those projects, maybe they'll be ready for the next pandemic, just like in Tanaka Sensei's earlier slides about predicting how to do things. So the positive news is that the pandemic has forced the issue and made us ask the questions. I think we yet don't have the answers.
The important thing was a consensus of the community about the usage of personal data.
We had a few other questions from audience members, one from Carmen, and this was about kind of the applications of AI and how it's improved living conditions and the care of seniors in Canada, perhaps improving the situation for seniors. I think that's more like in general how AI has improved the conditions for seniors. I think in both Japan and Canada, it would be interesting to hear.
I know of specific projects in Japan, and I would say that Japan's work on rapidly translating work in so-called chatbots to application environments is being done faster than in Canada, as actually faster than most places in the world. And the reason for that, I think, is that the use of chatbots in environments means concentrating on the knowledge in the environment. There is no magic solution by an Alexa-like robot on wheels, for example. In Canada, there are projects that are trying to produce such chatbots and train them and support them with knowledge to be able to be a kind of electronic companion for aging citizens. But the promise is that if you can build those in a way that helps support the day-to-day activities of a senior, you keep them out of aging homes and care homes, for example. But we have yet to see any specific instances that is actually working and deployed. We only see a few experiments about it.
Yeah, that's a really interesting point, especially as so many seniors are in isolation in homes, unable to have guests or to interact with their family members. So
a dog is a great companion, but a robot can remember whether you took your pills yesterday.
Right. Dr. Tanaka, do you have any other insights in the use of AI in seniors' care?
Yeah, in general, the use of AI in Japan is a little bit different from North America. In Japan, focus more on developing for robots to care people, accompany people. They focus on the research on emotion, feeling, such kind of thing. Whereas in North America, the AI focuses more rational reasoning or the performance improvement.
That's really interesting. I actually had no idea. So in Japan, the focus is more on emotional support and that side of it. And in North America, it's more focused on rational. It's really interesting. Could both of you talk more generally about the ways that this crisis of the pandemic has, in some sense, pushed the development of technology forward?
Let me say first is that this isn't the first time where an emergency has precipitated a change in scientific disposition. So I'm remembering the earthquake and tsunami in Japan. And remember, I have close connections in Japan. What you saw almost immediately was an expected consequence of the Japanese culture. And that is you saw scientists across Japan not necessarily searching for new sources of funding to help with the consequences, but even redirecting their current energy and facilities and resources to combine to refocus to address those problems. I would say that part of that has happened in Canada. Part of it has happened because of federal public research infrastructure seeding a whole variety of new programs to invest. Almost every scientist I know, from computer scientists to engineers to epidemiologists to virologists, have all been working much harder and much more in a focused way to accelerate any aspect of what we've spoken about today to help support remediation of the pandemic, all the way from design of new vaccines like at U of A to public health interventions and identifying cohorts with disease on a short function to identify populations at risk, for example. With that said, the acceleration of the science is absolutely been amazing. We've gone in a year from acknowledging that there's a problem with a virus that has 230,000 point mutations, like Yuzuru showed in his genomics thing, to having vaccines that, what a momentous day in Canada today, the first vaccines are being deployed. To do that amount of work in such a short time would not have ever happened in the world.
Yeah, as to the impact of COVID-19 to technology development, I'd like to pick up two things. The first one, the literature-based knowledge discovery. After this pandemic, you can see a huge number of publications, medical, biomedical publications. Yeah. And no one can read all of them. It's very important to see all of them to find out a good solution. Only AI can do this. But the problem is how to extract the useful knowledge and how to check if it is really workable.
Yes.
The second thing is the big trend from real workplace to or real world life to cyberspace life. And this trend was accelerated by this pandemic. Yeah. And that means now there are lots of accumulation of big data about the people's behavior in the cyber world, especially in education, in this kind of a meeting. The next step is how to utilize these data and for the analysis to obtain useful knowledge.
One of the great challenges that emerges each time something like the scientific document analysis or literature-based discovery is pursued, that gives the person who's not studying artificial intelligence some sense, is that it remains nearly impossible to detect contradiction between two different sources of information. When the World Health Organization 2 falls ago announced that red meat is carcinogenic, we didn't then and still don't have the tools to classify all of the literature into those which support that hypothesis and those which deny that hypothesis. We don't have any way to separate them and measure them scientifically as to who is, quote, more right than the other. And that's what one of the challenges of literature-based discovery is. It's just a difficult task to find out when people are contradicting each other.
Yeah, that's a good point. And I loved that graphic from your presentation of the tsunami of papers. Yeah. It really kind of captures the challenges that you're describing. And actually related to this question of the proliferation of information and how to make sense of that, we have a question here from Jeffrey Rockwell. So Jeffrey asks, an important part of controlling the pandemic seems to be convincing people to abide by social distancing directives and other guidelines around things like masks. How can AI help with predicting public uptake of guidelines or of identifying ways of improving communication?
One of the things that's important is back to social media analysis. So we can learn a lot about what you might call jurisdictional societies by watching at how they exchange information and how they react to information from authorities. We're currently considering how to assess the impact of what is said publicly by our jurisdictional chief medical officer, Dina Henshaw, versus our chief political officer, the premier of the province, Jason Kenney. And what we want to be able to do is to, if you like, build models that would predict how people react to what they've seen so far in order to better formulate interventions that will help reach those parts of the population that aren't paying attention. So for example, late last week, Alberta introduced these YouTube videos and advertisements that talked about inviting Mr. COVID to your house party. So it was actually rather crudely done, but well intended from the message point of view of having someone with a COVID mask that looked like the COVID protein with its spikes going to a house party or going to some event where it just reinforced the idea about how easy it was for this to spread. So there's an example informed by someone's media and communications people to say that we have to reach some parts of the population with things like this, rather than try to appeal to everyone having the same knowledge of what it means for this disease to spread. So there've been lots of different, if you like, social campaigns that are much like the design of modern advertising. is they need to get your attention. They need to convey a message that's clear and simple and hope that it has an impact more broadly. And so we've seen that, and there's a group, Jeffrey will know something about this, a group trying to model what we think the public media reaction is in time and in the social media to what those presentations are. Because ultimately, answering that question is to build a better understanding of the social jurisdictional cohort. It's the sociology of that group. It's got nothing to do with being rational about the science, as Yuzuru said earlier. It's about trying to understand how to convey something to a public. It's like the old days of trying to convey to people that seatbelts actually save lives, so you should put them on.
Mm-hmm. Yeah, so the use of these models, not only in predicting the spread of the pandemic, but predicting the spread of misinformation and trying to figure out how to combat that. Dr. Tanaka, I'm really curious, has Japan experienced a similar challenges with pandemic fatigue and misinformation? And how do you think AI can help improve public messaging?
As to the disinformation identification, there's already some tools, but it's not perfect yet. I think finally it becomes a cat and mouse game. So the AI will be improved to detect some of the disinformation, but at the same time, the spread of the disinformation may also use advanced technology to avoid this kind of barrier. This kind of a game was just started and will continue in the future.
We see this a lot, not necessarily directly caused by the pandemic. We're very familiar these days with Twitter posting red flag on a Donald Trump tweet that says the accuracy of this information is disputed. That's kind of like a step forwards for us in Canada to observe that from the United States, to say that the current president of that country is saying things that are disputed by most of the population, and so that's classified by Twitter. I think that's an instance of a kind of a crude version of the solution. The more accurate version is the kind of debates we have where we actually, for example, enter into conversations about the validity of vaccines with that subset of society thinks that they're all a scientific hoax, for example. And so that's partly the way we make progress.
I think it's very important to distinguish the wrong information and disinformation.
Yes.
For example, in Japan, Osaka prefecture authorities once talked about the efficacy of povidone iodine to prevent the COVID-19 infection. This is a case of wrong information. This didn't have much evidence. Yeah. Although they showed some evidence, but the evidence was very small. Later, some other authority criticized this misleading information. This is not disinformation. In case of COVID-19, there are a huge number of such wrong information among us, and some came from even experts.
I think that's a really important point. Related to that, Dr. Tanaka, you've talked about how AI is used to forecast different possible pandemic scenarios, which in your slides you called germ games as opposed to war games, which I think is a great term. What are some misconceptions about these COVID forecasting models, and how do we help the public make sense of this data and not misinterpret it?
I had been perpetually in and out of talks with Alberta Health Services to try to use AI to help them in everything from contact tracing to prediction of at-risk communities. So in Canada, it's kind of like a serious contradiction about predicting at-risk populations. So it's no one surprise that there are communities that are identified by ethnic origin, by poverty, by the position that they hold in society, by the social determinants of health. For example, some of our Indigenous population. It's no surprise to anybody that sometimes they are at higher risk for COVID for a number of reasons. One is that sometimes it's more difficult to communicate to them as a population, as a cohort. And other, it's just sometimes more difficult to identify them. So with Alberta Health Services, it's kind of funny. We want to be able to predict on short cycles and new data that there is a rapidly changing number of COVID positive patients in, for example, the Northeast Edmonton Filipino community. If we can predict that and make that accurate with respect to those populations, then we can take public health measures to try to address the problem. So is the problem, for example, that the public health interventions and statements and communication about how to prevent the spread of disease simply not landing in that community because of language problems? So that makes good sense. The bottom line is that Alberta Health Services won't capture or communicate or share that data because it's politically incorrect to identify someone as an Indigenous person or a Filipino person or a Black person and so on and so forth. There's this contradiction in the political correctness, which gives rise to this confusion of what I call jurisdictional Darwinism. We don't gather the data we need to do the job we claim we need to do that is politically correct, that is identify at-risk populations, because we don't get the data and share it in the first place. It's very strange. I suspect things are better in Japan.
Technologically speaking, such kind of forecasting system is based on mathematical models with lots of parameters. Some parameters can be best designed. Some others cannot be best identified. We still need to input some possible value, such parameter. And furthermore, some simulation systems use the so-called data simulation with real outcome. But still, once some prediction result was obtained, then the people's reaction may change, and the countermeasure is also operated. So the real outcome is a mixture of those things. It's quite difficult to accurately predict the future because of this kind of mixture of people's behavior and of the historical data.
And they affect each other, as you noted, so makes it even a harder problem.
Yes, that's a really good point. So as soon as you put that information out there, of course, people react to it and they change. So the prediction no longer becomes.
Well, think about what we face today. The public excitement about Canada for doing its first COVID vaccine is going to have a negative effect in all those jurisdictions where there are groups of people who ignore what we're trying to do to prevent the spread. They said, oh, no worry now, we'll all be vaccinated soon. We won't have to worry about it.
Yeah, that's a good point. I had one other question from Carmen, actually for Dr. Tanaka, and she was asking, what is the beautiful background and scenery in the back behind you?
This is a very famous conference site in Germany. Professor Goebel and I love this place.
Yes, very much. Yeah, we
it's
both attended.
Especially set up for computer scientists in the world to have a week-long workshop, very intense workshop. So it's located in a very remote location.
Yeah, you can't leave the conference center and go out for a tour. You have to stay in the conference center, behave yourself. Right behind Tanaka Sensei's head is the music room with a piano and guitar and a number of instruments. They're a great dining hall and especially a great wine cellar.
Yeah.
That's so wonderful.
I hope is the name. We have equivalents. BERS in Canada, the Banff International Research Station, is similar for Canada. The Shonin Conference Center outside of Tokyo is the same for Japan.
Well, I hope that soon, Randy and Yuzuru, you can visit there again. I had one last brief question, and if you could briefly sum up, how do you hope that AI can be used to build a better post-pandemic world?
For the moment, we cannot consider the social life without COVID-19. We have to live with this disease, pandemic. Although the strength of the pandemic will be lowered, we have to move more to the cyber world for various kinds of activities. One of the most serious problems is that even the research activities in private companies or in universities, laboratory, are done through this kind of video conferencing tools. There's no guarantee that there's no information leakage outside the meeting members. The platform technology is becoming more and more important. Some case, some community should develop their own platform to protect their information and knowledge. This will be the next step to consider.
A complement to that is that the pandemic, especially in the science, the systems biology science and the public health science, has helped us understand what data is most relevant to modeling and making predictions. It's a forcing function for us to more rapidly test what data we have to gather to be able to make higher value predictions that can actually make a difference. So I think that that's what we'll keep our eye on in the future. And it's related to what Tanaka Sensei said, is we need to be able to develop the good ideas in a secure way to be able to test them and demonstrate their value, much in the way that the old system of randomized clinical trials could take 10 years to go from potential drug to confirmation of its use. We need to do that in 10 months, not 10 years.
I think we will have more AI technologies to evaluate the results coming from the other AI systems.
Yes.
Well, thank you both for joining us today for this discussion and for the many things that you've given us to think about.
Thank you very much for this very engaging and powerful dialogue. We are really so lucky to have two of you, two top computer scientists here with us today. And I'm grateful for both of you, Professor Goebel and Professor Tanaka, and Consul General Shigenobu Kobayashi for this opportunity, and Chelsea for moderating the session and for making this happen. This is the last webinar for this year, but our past webinars are all available on our website, and we will continue hosting more events in 2021. So for more information, please visit our website, PTJC at the University of Alberta, and please follow us on Twitter at PTJCUA1 or email us at ptjc@ualberta.ca. And thank you very much, everybody, and who participated in this event. And thank you, Claire, Grant, Oliver, everybody, and Merry Christmas, everyone, and Happy New Year. ありがとうございました。
ありがとうございます。
Thank you.